Hi, I'm Gillet from Health and Motion Physical Therapy and Wellness, and I'm here to talk about primitive reflexes and lifelong reflexes and give an example of these reflexes. These are reflexes that they begin in utero, so when we are, before we're born, and they make the foundation of our movement, perception, behaviors, and they're usually the primitive reflexes are usually integrated by 5-6 years old. But if we've had a traumatic birth, or if we have trauma in our lives at a very young age, they can remain unintegrated. And then also later on in adulthood, if we have traumatic events such as brain injuries, car accidents, very, very stressful situations, and things like that, or illness even, these reflexes can actually come back. So we look at these in physical therapy because they can drive abnormal movement patterns, pain patterns, and dysfunctional movement. So we're gonna have Stephanie, and we're gonna demonstrate one. And this is a trunk head riding reaction. So basically, when we lean to the side, our head side flexes the other way, and our trunk elongates on that side. And this is so it keeps our eyes level against the horizon, which we have a lifelong reflex for that, and it keeps our balance. So, and then I'm going to do a quick one, and then if she lost her balance, she's going to bring her leg out. And then someone that maybe does not have this reflex anymore, we would tip them and they would just kind of fall over. And if we tip them fast, they would just fall over.
Don't do that.
But then also sometimes even just doing the reflex, they might have tension in the nervous system. So for instance, if Stephanie was just falling over, I could facilitate this reflex with my hands and then see what effect it has on the nervous system. And then we can use the laser. This is a cold laser. We can use this on the nervous system to help stimulate that reflex. Well, you still have it. And then we have some tension in Stephanie's cerebellum over on this side. And this is a balance center. So I can hold that tension pattern there, and then we put the laser on to help that release and also help re-stimulate that reflex. And we have about 10 seconds to put the laser on and also to put my hands on to affect that reflex before the nervous system forgets about it. And then we can retest that reflex and reflex and hold the tension pattern, and then you don't feel the tension, and you might feel another tension that we need to work on. So that's an example of a lifelong reflex that we all need to be having. And if not, that really affects our balance, because when we walk, if we put weight on one leg, we need to elongate the whole side of the body, and then and if we don't, then we're going to end up falling over to that side. So very important reflex to always look out with pretty much everyone that walks in the door. And then another reflex I wanted to talk about that is abnormal if we have this, into adulthood, is called the asymmetrical tonic neck reflex. And if anyone's around babies, they might notice that the baby is the archer, and they look like this when they're laying on their back. And that's called, and we call it ATNR, or asymmetrical tonic neck reflex. And if that persists into adulthood, you can have, like if you're driving, for instance, and you see something on the side of the road, well, you start turning your head, you bring your arm across, and then you can run off the road. So that's a very important reflex to have integrated. So like people that have head injuries, especially, we make sure that these reflexes are integrated. So to look at that reflex, we'll have Stephanie get down on her hands and knees, And then to test for this one, we would turn her head, and then that's normal. And then we'll turn her head this way. If her elbow bent, then that would be a non-integrated asymmetrical tonic neck reflex. Because again, she turns her head and she's starting to do the archer thing, so she would bend the elbow. And we would integrate that the same way as we integrated the other reflex. Thank you so much. Bye.